In anatomy, the scapula, plural scapulae or scapulas, also known as shoulder blade or wing bone, is the bone that connects the humerus, upper arm bone, with the clavicle, collar bone. Like their connected bones, the scapulae are paired, with the scapula on either side of the body being roughly a mirror image of the other. In early Roman times, people thought the bone resembled a trowel, a small shovel. The shoulder blade is also called omo in Latin medical terminology. The scapula forms the back of the shoulder girdle. In humans, it is a flat bone, roughly triangular in shape, placed on a posterolateral aspect of the thoracic cage. Structure. The scapula is a wide, flat bone lying on the thoracic wall that provides an attachment for three different groups of muscles. The intrinsic muscles of the scapula include the muscles of the rotator cuff, the subscapularis, Teres Minor, supraspinatus, and infraspinatus. These muscles attach to the surface of the scapula and are responsible for the internal and external rotation of the shoulder joint, along with humeral abduction. The extrinsic muscles include the biceps, triceps, and deltoid muscles and attach to the coracoid process and supraglenoid tubercle of the scapula, infraglenoid tubercle of the scapula, and spine of the scapula. These muscles are responsible for several actions of the glenohumeral joint. The third group, which is mainly responsible for stabilization and rotation of the scapula, consists of the trapezius, serratus anterior, levator scapulae, and rhomboid muscles and attach to the medial, superior, and inferior borders of the scapula. The head, processes, and the thickened parts of the bone contain cancellous tissue, the rest consists of a thin layer of compact tissue. The central part of the supraspinatus fossa and the upper part of the infraspinatus fossa, but especially the former, are usually so thin in humans as to be semi-transparent. Occasionally the bone is found wanting in this situation, and the adjacent muscles are separated only by fibrous tissue. Surfaces. Front. The front of the scapula, also known as the costal or ventral surface, has a broad concavity called the subscapular fossa, to which the subscapularis muscle attaches. The medial two-thirds of the fossa have three longitudinal oblique ridges and another thick ridge adjoins the lateral border. They run outward and upward. The ridges give attachment to the tendinous insertions, and the surfaces between them to the fleshy fibers, of the subscapularis muscle. The lateral third of the fossa is smooth and covered by the fibers of this muscle. At the upper part of the fossa is a transverse depression, where the bone appears to be bent on itself along a line at right angles to and passing through the center of the glenoid cavity, forming a considerable angle, called the subscapular angle. This gives greater strength to the body of the bone by its arched form, while the summit of the arch serves to support the spine and acromion. The costal surface superior of the scapula is the origin of first digitation for the serratus anterior origin. Back. The back of the scapula, also called the dorsal or posterior surface, is arched from above downward, and is subdivided into two unequal parts by the spine of the scapula. The portion above the spine is called the supraspinous fossa, and that below it the infraspinous fossa. The two fossae are connected by the spinoglenoid notch, situated lateral to the root of the spine. The supraspinous fossa, the smaller of the two, is concave, smooth, and broader at its vertebral than at its humeral end. Its medial two-thirds give origin to the supraspinatus. The infraspinous fossa is much larger than the preceding. Toward its vertebral margin a shallow concavity is seen at its upper part. Its center presents a prominent convexity, while near the axillary border is a deep groove which runs from the upper toward the lower part. The medial two-thirds of the fossa give origin to the infraspinatus. The lateral third is covered by this muscle. There is a ridge on the outer part of the back of the scapula. This runs from the lower part of the glenoid cavity, downward and backward to the vertebral border, about 2.5 cm above the inferior angle. Attached to the ridge is a fibrous septum, which separates the infraspinatus muscle from the teres major and teres minor muscles. The upper 2/3 of the surface between the ridge and the axillary border is narrow, and is crossed near its center by a groove for the scapular circumflex vessels, the teres minor attaches here. The broad and narrow portions above alluded to are separated by an oblique line, which runs from the axillary border, downward and backward, to meet the elevated ridge. To it is attached a fibrous septum which separates the teres muscles from each other. Its lower third presents a broader, somewhat triangular surface, the inferior angle of the scapula, which gives origin to the teres major, and over which the latissimus dorsi glides. Frequently the latter muscle takes origin by a few fibers from this part. Side. The acromion forms the summit of the shoulder, and is a large, somewhat triangular or oblong process, flattened from behind forward, projecting at first laterally, and then curving forward and upward, so as to overhang the glenoid cavity. Angles. There are 3 angles. The superior angle of the scapula or medial angle, is covered by the trapezius muscle. This angle is formed by the junction of the superior and medial borders of the scapula. The superior angle is located at the approximate level of the second thoracic vertebra. The superior angle of the scapula is thin, smooth, rounded, and inclined somewhat later outward, and gives attachment to a few fibers of the levator scapulae muscle. The inferior angle of the scapula is the lowest part of the scapula and is covered by the latissimus dorsi muscle. It moves forwards round the chest when the arm is abducted. The inferior angle is formed by the union of the medial and lateral borders of the scapula. It is thick and rough and its posterior or back surface affords attachment to the teres major and often to a few fibers of the latissimus dorsi. The anatomical plane that passes vertically through the inferior angle is named the scapular line. The lateral angle of the scapula or glenoid angle, also known as the head of the scapula, is the thickest part of the scapula. It is broad and bears the glenoid cavity on its articular surface, which is directed forward, laterally, and slightly upwards, and articulates with the head of the humerus. The inferior angle is broader below than above and its vertical diameter is the longest. The surface is covered with cartilage in the fresh state, and its margins, slightly raised, give attachment to a fibrocartilaginous structure, the glenoidal labrum, which deepens the cavity. At its apex is a slight elevation, the supraglenoid tuberosity, to which the long head of the biceps brachii is attached. The neck of the scapula is the slightly constricted portion which surrounds the head and is more distinct below and behind than above and in front. Borders. There are 3 borders of the scapula. The superior border is the shortest and thinnest, it is concave, and extends from the superior angle to the base of the coracoid process. It is referred to as the cranial border in animals. At its lateral part is a deep, semicircular notch, the scapular notch, formed partly by the base of the coracoid process. This notch is converted into a foramen by the superior transverse scapular ligament, and serves for the passage of the suprascapular nerve. Sometimes the ligament is ossified. The adjacent part of the superior border affords attachment to the omohyoideus. The axillary border, or lateral border, is the thickest of the 3. It begins above at the lower margin of the glenoid cavity, and inclines obliquely downward and backward to the inferior angle. It is referred to as the caudal border in animals. It begins above at the lower margin of the glenoid cavity, and inclines obliquely downward and backward to the inferior angle. Immediately below the glenoid cavity is a rough impression, the infraglenoid tuberosity, about 2.5 cm, 1 in length, which gives origin to the long head of the triceps brachii. In front of this is a longitudinal groove, which extends as far as the lower third of this border, and affords origin to part of the subscapularis. The inferior third is thin and sharp, and serves for the attachment of a few fibers of the teres major behind, and of the subscapularis in front. The medial border, also called the vertebral border or medial margin, is the longest of the three borders, and extends from the superior angle to the inferior angle. In animals it is referred to as the dorsal border. 4 muscles attach to the medial border. Serratus anterior has a long attachment on the anterior lip. 3 muscles insert along the posterior lip, the levator scapulae, uppermost, rhomboid minor, middle, and to the rhomboid major, lower middle.
Please subscribe and thanks for watching.